A 25-year-old baseball player was hit in the head by a baseball 2 months ago. He was taken to the hospital where x-rays were obtained and no fractures were found. He was given acetaminophen for several days after the accident, but he felt no relief. Before the accident, he was scheduled to be traded to the minor leagues because he was not playing well. Since the accident, he has continuously complained of headaches. The team physician found no abnormality, and he has been unable to play because of the headaches. The theme of this case is, of course, pain. And that is what you find in the somatoform pain disorder. This is the individual who has pain as a primary complaint. The pain could be in one site, in multiple sites. You see it more frequently in women. These patients tend to be a little bit older, and there's usually some type of secondary gain, meaning these patients are getting some benefit from complaining of the pain, whether it be work-related, home-related, or any other kind of issue. Now, the pain is usually distressing to the patient, and there's usually psychological factors. And these patients truly believe that they are in pain. They're not consciously faking their pain symptoms. Because of the pain, they're going to go to specialists. They're going to have all kinds of procedures done. They probably have multiple surgeries. They're constantly worried about the pain. And of course, because of the pain, many of them will be suffering from depression as well. Now, the treatment, as you can see by this slide, is numerous. But for the purpose of our examination, because this is a psychiatric disorder, the treatment of choice will still be individual psychotherapy. Biofeedback, hypnosis, antidepressants, nerve blocking are all affected, but the #1 treatment of choice will be individual psychotherapy. As far as the differential diagnoses, make sure that these patients are not suffering from muscle contraction headaches or they have some other type of somatoform disorder as the cause of their pain. Now, I have finished talking about all the somatoform disorders, so let's review something which is going to be different when we talk about somatoforms versus factitious versus malingering. Here, I want you to focus on two things. One is symptom production, and the other one is symptom motivation. When you think of somatoform disorders and you think of symptom production, what I'm trying to imply is, do these patients know what causes the symptoms? And because these are only psychological in origin, these patients are totally clueless as to where these symptoms are coming from. So the symptom production is unconscious. As far as the symptom motivation, what I mean is, do they know what drives them to have these complaints? Because they don't know that they're the ones producing the complaints, I cannot imagine that they would know what the driving force is. So somatoform disorders is purely psychological. So that is why the treatment of choice will be individual psychotherapy. These are patients who truly believe they have a problem. These are patients who are not faking anything in order to get attention. They're not faking things for an obvious gain. So that's why psychotherapy is the treatment.